Atrial fibrillation, or AFib, is the most common type of irregular heartbeat and is a significant risk factor for stroke and heart disease. It affects millions of people worldwide and can lead to serious health complications if left unmanaged. While certain factors like age and family history may be out of our control, adopting certain lifestyle modifications can play a substantial role in AFib prevention. In this video, we'll uncover the most effective ways that you can minimize the risk of developing AFib to live a heart-healthy life. Keep watching until the end because there are a few techniques that I think will surprise you. So, if you're ready, let's get into it. Number 1. Eat a healthy diet. A healthy diet is the cornerstone of preventing many health conditions, including atrial fibrillation. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help control blood pressure and cholesterol levels, which are key risk factors for AFib. Additionally, it's important to limit the intake of sodium and high-sugar foods, as they can lead to conditions that make AFib more likely, like obesity and diabetes. One diet you may consider is the DASH diet, which is often recommended for those at risk of heart disease. Number 2. Exercise. Regular physical activity is another crucial factor in preventing AFib. Exercise helps in maintaining a healthy heart rate, managing weight, reducing stress, and controlling blood pressure. Moderate intensity exercise, such as brisk walking, swimming, or biking for at least 30 minutes a day, 5 days a week, can significantly lower your risk of developing AFib. It's important to remember that sudden, intense workouts can strain your heart, so gradually increasing intensity and duration is the safest approach. As always, consult your doctor before starting a new exercise regimen. And that leads perfectly to number 3, which is to maintain your body weight. Being overweight or obese increases the risk of AFib. Excess weight can put a strain on your heart, leading to a higher risk of AFib and other heart-related conditions. Weight maintenance is achieved through a combination of healthy eating and regular physical activity. For those who are overweight, a weight loss of just 5 to 10% can result in significant health improvements. The next method on our list is to avoid alcohol. Excessive alcohol consumption can trigger episodes of AFib, as it may increase your heart rate and lead to high blood pressure. It's recommended that women have no more than 1 drink per day, and men have no more than 2. Binge drinking, which involves having 4 or more drinks in a 2-hour period, is particularly harmful. If you already have AFib, even moderate alcohol consumption could potentially lead to an episode, so it's best to discuss with your doctor whether any amount of alcohol would be safe for you. Another important way to prevent AFib is to quit smoking. Smoking is one of the leading risk factors for many cardiovascular diseases, including atrial fibrillation. The chemicals in tobacco smoke can damage the structure and function of your heart and blood vessels, leading to a higher risk of AFib. Quitting smoking can significantly lower your risk. This often requires a comprehensive approach, including behavior modification, counseling, and possibly medication. Numerous resources are available to support people in their journey to quit smoking. Number 6 is to manage your diabetes. Diabetes, particularly when poorly managed, increases the risk of AFib. High blood sugar levels can lead to damage in the blood vessels and nerves that control the heart, increasing the chance of heart diseases. Managing diabetes through a combination of healthy diet, regular exercise, medication if prescribed by your doctor, and regular monitoring of blood glucose levels is essential to minimize the risk of AFib and other cardiovascular complications. Another thing is that you must manage your levels of stress. Chronic stress can have a negative impact on heart health and can potentially lead to conditions like AFib. This is due to the release of stress hormones that can increase heart rate and blood pressure. Regular stress management techniques such as meditation, yoga, deep breathing, tai chi, and other relaxing exercises can help reduce stress levels and maintain a normal heart rhythm. Furthermore, maintaining a strong support network of friends and family and seeking professional help if needed can contribute to effective stress management. The next method on our list involves getting quality sleep. Quality sleep is key to maintaining good health, including heart health. Sleep disorders, especially sleep apnea, are often associated with AFib. Sleep apnea is a condition where breathing is interrupted during sleep and can cause low oxygen levels and raise your blood pressure, leading to strain on your heart. which is why ensuring that you get sufficient, uninterrupted sleep is important. If you have symptoms of sleep disorders such as excessive daytime sleepiness, loud snoring, or pauses in breathing during sleep, seek medical advice. Treatment of sleep disorders can reduce the risk of AFib and improve overall well-being. Number 9 is to stay hydrated. Dehydration can cause a strain on your heart and lead to conditions like low blood pressure and rapid heartbeat, which may increase the risk of atrial fibrillation. Drinking adequate amounts of water can help maintain the balance of minerals in your body, which are essential for normal heart functions. The amount of water each person needs can vary, but a general rule is to drink enough so that you rarely feel thirsty and your urine is colorless or light yellow. Number 10. Limit caffeine. Although moderate caffeine intake is generally considered safe, excessive amounts can stimulate your heart rate and may lead to episodes of AFib. While this impact can vary greatly from person to person, it is generally suggested to limit caffeine intake if you're at risk for AFib. This doesn't mean you need to cut out coffee or tea completely, but moderation is key. Just be sure to remember that caffeine is not just in coffee, but also in many teas, soft drinks, energy drinks, and even some medications. Another thing that you should consider limiting is sodium, because high sodium intake can lead to high blood pressure, a significant risk factor for AFib. Reducing sodium in your diet involves more than just putting down the salt shaker. It also requires paying attention to food labels, as many processed and prepared foods have high sodium content. Try to focus on including more fresh, whole foods in your diet and seasoning with herbs and spices instead of salt. The next method on our list may surprise you, and it involves cold exposure. Contrary to what you might expect, controlled cold exposure could actually be beneficial for those experiencing episodes of atrial fibrillation. This concept is based on the principle of vagal stimulation, or activating the vagal nerve, which plays a significant role in regulating heart rate. By immersing your face in cold water, taking a cold shower, holding an ice cube against your forehead, or standing in front of an open freezer door, you could stimulate the vagal nerve, leading to a reduction in heart rate. And this could potentially help manage acute AFib episodes. The next method on our list is simply to eat more potassium. Potassium plays a key role in heart function, including maintaining a regular heartbeat. Low potassium levels can contribute to arrhythmias, including AFib. Therefore, incorporating more potassium-rich foods in your diet can be beneficial. Some example of high potassium foods include bananas, oranges, spinach, sweet potatoes, and avocados. However, individuals with certain conditions like kidney disease need to be cautious with potassium intake, so it's always best to discuss dietary changes with your healthcare provider. Next up on our list is the Valsalva Maneuver. The Valsalva Maneuver is a specific breathing technique that can sometimes be used to manage episodes of rapid heart rate, such as AFib. It involves taking a deep breath and straining as if you're trying to have a bowel movement. This increases pressure in the chest and can affect the nervous system's control of heart rate. However, the technique should be performed under the guidance of a healthcare provider, as it's not suitable for everyone, and improper technique can cause complications. And that leads to another effective technique, which is belly breathing. Also known as diaphragmatic or deep breathing, belly breathing can help manage stress, a significant trigger for AFib. When practiced regularly, it can induce a relaxation response, lower heart rate, and help manage a normal heart rhythm. To do this, breathe deeply into your belly, rather than shallowly into your chest, and exhale slowly. Practice this daily and during periods of stress to promote a relaxed state. Another uncommon method that many don't consider is acupuncture. You may be surprised to learn that acupuncture, a key component of traditional Chinese medicine, has been studied for various health conditions, including AFib. While more research is needed, some studies suggest acupuncture may help to reduce AFib episodes by stimulating specific body points to rebalance the body's energy flow. If considering acupuncture, it is crucial to find a certified practitioner and discuss it with your healthcare provider, as it may not be suitable for everyone and should be part of a comprehensive management approach. While AFib poses a significant health concern, numerous proactive measures can be taken to mitigate its risk. However, it's always important to consult a healthcare provider before making significant changes to your health regimen. With this knowledge, preventative measures, and a commitment to overall wellness, it's entirely possible to lead a healthy life while reducing the risk of AFib. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you'll enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day, and as always, breathe easy, my friend.